Hi! Studies have shown about 85% of women experience vaginal infection at some point in their life. So if you're there now, don't you worry, you're not alone. I am going to share with you the reasons you keep getting vaginal infection and how you can manage it. This video is sponsored by Remedies Fertility Specialist Hospital and Assisted Reproductive Center located at 15B/17 Atunukola Banji Street, Ikeja, Lagos. They offer services like IUI, IVF, ICSI, etc. for as low as 500,000 naira. You can also donate eggs and sperm to their bank for a token. Do want to check them out at Genesis Facility on IG, www.regenesisfertility.com.ng, or call 081 300 20130. Hello friends, welcome to my channel. I'm so glad you could join us again today. To all our first timers in the building, thanks for checking out this community. My name is Rosemary. I would like you to please subscribe to our channel and turn on your post notification. That being said, let's get straight to the point. Vaginal infection is the inflammation of the vagina or vulva caused by bacteria or fungal infection. So here's the third reason your vaginal infection keeps recurring. When imbalance in the vagina, you're definitely going to trigger variation in your vagina if you are fond of douching, scrubbing, or using harsh soap to clean your vagina, and if you're an abuser of antibiotics or antifungal medication. All this can lead to unstable environments like imbalanced pH, overgrowth of bacteria, or absorbed growth of candida in your vagina. 2. Weak immune system. People with diabetes, high estrogen level, compromised immune system like cancer or autoimmune disease, and other risk factors are prone to genital infection. Unless the underlying condition is being tackled, vaginal infection would reoccur even after treatment. 3. The wrong choice of underwears. Wearing an undersized or tight underwear tends to make you sweat and also brings your discharge close into your body. Wear underwears made of cotton and breathable fabrics. 4. Humidity and moisture. Wearing damp clothes will contribute to growth of bacteria or yeast as they thrive more in wet conditions. Wash and sterilize any clothing used during infection. Always wear dry underwear. It's better to go pantless than to use a wet pants. Occasionally press underwear if you can't dry it in the sun. 5. Poor hygiene. Habits like not having daily regular bath, not changing your pants for a long period of time, or long use of pad leaves you susceptible to infection. As a woman, you should change your pants twice daily. Use 1 or 2 panty liner daily if you can. Replace tissue with feminine wipes to clean your intimate area from the front to the back. Your sanitary pad should always be changed 3 to 4 times during your cycle. Keep it dry and clean down there. 6. Self-medication. Most of us are guilty of using over-counter medication. Infections are either caused by bacteria or fungi. We need to understand that there are different types, class, and functions of antibiotics. The likes of bacteriostatis that stops the work of the bacteria, the bactericida that kills the bacteria, and their sensitivity. Same goes for the antifungal too. So you don't just use a drug without test and doctor's prescription. Normally, urine MCS will be conducted to determine the agent and the type of drugs to be administered. Although when the wrong medication is used, the symptoms may reside or subside, but that's what the main cause has not been stopped or killed. Prolonged use make your body become resistant to the drug, meaning the drugs won't work for you again. Then number 7, incomplete treatment. Should you fail to complete your dosage, the infection will recur, especially if it's a long-term treatment. 8. Toilet infection. Far from the general belief, you may rarely contract vaginal infection using a dirty toilet, but you may have STD and so on if you have an open wound which gets in contact with an infected surface on the toilet, or if you would rather sit than squat to use a public toilet. Let's say you place layers of tissue on a toilet brim already wet with infected urine. When you sit, the tissue in contact with your genital gets soaked, thereby infecting you. If you must sit, rinse the toilet with an antiseptic solution. 9. Pregnancy. The changes your body go through during pregnancy can disrupt your estrogen and progesterone level, thereby influencing the presence of yeast in your vagina. Just eat healthy and see your doctor when you need to. 10. Recurrent transmission. Recurrent transmission can occur in 2 ways. One is sexual activity. Although it's not STI, but it can be passed back and forth between sexual partners. Should you have vaginal infection, I would advise you get treated alongside with your partner in order to off the cycle. The second one is the contact. Candida can be found in mouth and skin and can be spread via skin to skin, especially between breastfeeding moms and babies. This is the end of today's video. If you would like to see more of this video, please click subscribe button and give this video a thumbs up. See you in my next video. Bye.